Hi, today I'm going to talk about Ribavirin for chronic hepatitis E virus infection in transplant recipients. Hepatitis E. It is a liver disease caused by the hepatitis E virus, a non-envelope positive sense single-strand ribonucleic acid virus. The hepatitis E virus is transmitted mainly through the fecal-oral route due to fecal contamination of drinking water. Now we're going to see a video about the structure of hepatitis
Hello
E.
and welcome to Microbiology Bites. This week, the structure of hepatitis E virus. Viral hepatitis is caused by 5 distinct viruses called hepatitis A to E. Despite their name, these 5 viruses are unrelated, with totally different genome structures and replication mechanisms. Hepatitis E virus, or HEV, is responsible for endemic hepatitis as well as sporadic epidemics of acute enterically transmitted hepatitis in the developing world. HEV accounts for more than 50% of acute viral hepatitis in young adults in developing countries, with a case fatality of 1 to 2% in regular patients, but up to 20% in pregnant women. Because there's no robust cell culture system for this virus, and because it's not closely related to any other well-characterized virus, little is known about the molecular biology of HEV or its strategy for replication. HEV is a small icosahedral non-enveloped virus with a positive sense RNA genome of 7.2 kilobases. Its genomic RNA is polyadenylated and contains 3 open reading frames, or ORFs. HEV was originally classified in the Calliciviridae family because of its structural similarity to other caliciviruses. However, it's now regarded as the sole member of the Hepiviridae family. The genomic RNA of HEV exhibits several distinct features compared to the genomic RNA of caliciviruses, including a methylated cap at the 5' end and an ORF1 with functional domains arranged in a different order to caliciviruses. A recent paper in PNAS describes the crystal structure of hepatitis E virus at 3.5 angstroms resolution. The capsid protein of the virus contains 3 linear domains that form distinct structural elements. Each domain possesses a potential polysaccharide binding site that may function in cell receptor binding. Receptor binding to P1 at the capsid protein interface may lead to capsid disassembly and cell entry. These findings significantly advance our understanding of hepatitis E virus and are useful for the development of vaccines and antiviral medications.
The chronic hepatitis E virus infection in transplant recipients. Hepatitis E virus genotype 3 causes self-limiting infection in non-immunocompromised patients. However, it can lead to chronic hepatitis and cirrhosis in patients who have received solid organ transplants, patients with human immunodeficiency virus infection, and patients with hematologic cancer who are receiving chemotherapy.
Welcome to our video on the 5 most common questions liver transplant patients ask. I'm Dr. Joe Galati with the Center for Liver Disease and Transplantation at the Methodist Hospital in Houston, Texas. For the past 20 years, I've been involved in taking care of patients both before liver transplant as well as in the aftercare after a transplant. And over the years, I've had to answer a lot of questions from our patients that are waiting for transplants and their concerns. And so I put these together. The first question is, when will I get my liver transplant? Well, that's a question that's very difficult to determine. The actual time and date that you'll be called in to the OR for your transplant depends on a lot of factors. Now, as patients are getting more sick and ill and more complications, certainly there's a lot of anxiety and issues and concerns that both the patient and their family will develop. Who gets a transplant and when they get a transplant is based on a scoring system called the MELD score, which is the model for end-stage liver disease. And it's based on 3 blood criteria: bilirubin, how well the blood clots, and your kidney function. And so as someone has a rise in bilirubin and they become more jaundiced, this is a sign that their liver is not working as well. They're more sick, and they get a slightly higher priority. The other complication of chronic liver disease is kidney disease. The kidney will many times stop working, which will raise your creatinine, increasing your MELD score. The other factor that is carefully watched is how well your blood clots. That's based on your INR. As your liver disease progresses, you have more difficulty clotting, and again, you'll get more credit and get transplanted quicker. If you develop acute renal failure and you require dialysis, there are exceptions to get a higher score and get transplanted quicker. One other common complication of chronic liver disease is the development of liver cancer, shown here on this CAT scan. If you develop a hepatocellular carcinoma, there are exceptions to get a higher MELD score and get transplanted quicker. Now, in this part of the United States, transplants are being done for patients that have a MELD score of about 28. And so during this long road of waiting for transplant, it can be lonely at times, a lot of anxiety. But keep in mind that you have a transplant team behind you of doctors and nurses taking care of you during this very difficult waiting time for everybody. The next question is, what kind of a diet do I need to be on while I'm waiting for a transplant? Well, this is a very simple answer. You need to be on a low-salt diet, low in sodium. There's lots of different reasons why people have high salt intake, processed foods, food at restaurants, but high salt diets are associated with retention of fluid and lots of complications. All of us are going to tell you, take a diet high in fruits and vegetables and a very colorful diet as seen here. The enemy is always going to be fast food. This is food that is high in calorie, high in fat, low in nutrition, and also very high in its sodium content, which will lead to fluid retention and further problems. Another common question is, where will my donor come from? There's a lot of talk about live donors or cadaver donors. Well, the vast majority of the liver transplants are going to be done on individuals that have made the decision to donate their organs if something catastrophic happened to them, usually some sort of brain injury that would render the person brain dead and in a situation where it is not survivable. And we always try to educate the public on organ donation, working with our donor families to spread the good word on the gift of donating. So the livers will come from a cadaver donor once they are established to be brain dead, where there is no brain activity as seen on an EEG. Now, the liver or other organs will be recovered by a separate surgical team not associated with your transplant physicians. Another question is, how long do I have to take the anti-rejection medicines? These are medicines that you will start taking immediately after surgery, and they are the medicines that prevent you from rejecting your liver. You will have to be on these every day. The doses and how much you take varies from patient to patient, and over the last 20 years, the medicines are becoming easier to take, and they are much more effective in preventing rejection as well as preventing other complications from transplant. So you will meet with a pharmacist as well as be educated on the different medicines you'll have to take, but this will be the rest of your life. And the major issue as to why you need to be on these medicines is to prevent rejection and loss of the organ. Now, the final question is whether or not transplant is worth it. Should the individual and their family go through it? Well, again, over the last 20 or so years, I've taken care of thousands of families, and it is such a great opportunity to take care of these people because they are concerned about their husbands and wives, their children, their grandchildren, and they want to live to see the next generation succeed. And this is a very motivating part of their life, to get back to work, back into the swing of things, being with their family and resuming their usual activities, being with their children, being a productive member of the family and of the community. There are some patients over the years that have simply wanted to survive, to be with their family and travel the world, something that they just weren't able to do while they were sick for so long. Or many times, something a lot more simple, be able to visit their favorite team in their hometown and be part of the community once again.
In a large cohort of solid organ transplant recipients, virus of hepatitis C infection evolved to chronic infection approximately 66% of the patients and to cirrhosis in 10%. Furthermore, several HEV-induced extrahepatic manifestations like neurologic symptoms and kidney injuries have been reported in transplant recipients who are infected with a virus of hepatitis C. I'm sorry about that.
So I'm Dr. Carolyn Cooper, and I'm going to talk about hepatitis E. Hepatitis is inflammation of the liver, and hepatitis E is inflammation of the liver due to infection by a virus called hepatitis E. Hepatitis E is quite uncommon in the United States, but it is transmitted by contaminated water and uncooked foods. It is most prevalent in Southeast Asia, India, and Mexico, but is not very common in the US. Signs and symptoms of hepatitis E are usually very mild: jaundice, fatigue, abdominal pain, anorexia, maybe nausea and vomiting. It can be much more severe in women in their third trimester of pregnancy for unknown reasons. The treatment of hepatitis E is supportive care. It never progresses on to chronic disease. And the prevention of hepatitis E can be instituted by frequent hand washing, with soap and water after using the bathroom, changing diapers, or preparing food, and avoiding water and ice of unknown purity, and making sure that vegetables and fruits are peeled by the traveler or individual.
And for more information on the Tweedong movement, you can watch our three-part series on our website, english.ngdtv.com. And China's officials have approved the first vaccine for hepatitis E, a viral infection that causes inflammation of the liver. Hepatitis E is common in areas with poor sanitation, but less common than other hepatitis viruses.
The world's first hepatitis E vaccine has been approved for use. The drug will hit the market in June later this year. Researchers from China's Xiamen University developed the vaccine. It's the end result of 14 years of research and development. Hepatitis E causes inflammation of the liver. Epidemics have been reported in many parts of the world, including Central and Southeast Asia. It's especially common where fecal contamination of drinking water occurs.
The treatment about chronic hepatitis C, Ribavirin, for this illness. Ribavirin as monotherapy may be effective in treating chronic hepatitis C infection. A 3-month course seems to be an appropriate duration for the therapy. thought a longer therapy can be given to heavily immunosuppressed patients and those who still have viremia 1 month after the initiation of the therapy. I hope this video can help you to treat the hepatitis C. Bye.